Ever wonder why everyone in healthcare started calling it an ecosystem? It's not just a buzzword, it's a way to understand how every part of the system, from checkups to long term care, is connected. Today, we're diving into what that really means and why it matters to patients, providers, and yes, even lawyers like me. Hi there, and welcome to Health Law with Tara Ravi, your friendly guide to the world of healthcare law. Here we make healthcare law human, approachable, and a little more exciting than you might expect. We'll break down regulations, policy, and operational decisions that shape the care people actually receive, and uncover insights you can really use. Quick heads up, although I'm a healthcare partner at Bradley, the views expressed here are my own, and not the firm's or any of its clients, and they're not intended as legal advice. But I promise to make this fun, insightful, and practical. Whether you're a healthcare executive, attorney, clinician, or just someone who wants to understand the system better, you're in the right place. This is Health Law with Tara Ravi. Hi there, it's Tara Ravi. You know, the word ecosystem used to make me think of science class, trees, frogs, and rainforests, and now it's everywhere in healthcare, almost as much as AI. And honestly, it fits. Because healthcare today really is its own living, breathing ecosystem. Every provider, payer, policymaker, and patient is connected, and how they interact can make or break whether people get the care they need. So, what do we mean by ecosystem? When we talk about the healthcare ecosystem, we're really talking about different pieces that touch a patient's journey, sometimes just in one episode of illness. It might start with preventative care. This is when you're at home, just kind of trying to be healthy. Your annual checkup, a lab test, maybe a nudge to eat a little more kale, or if you're my husband, a little more beans. Then comes chronic care management, maybe a nurse or digital health coach checking in through that smart ring everyone's wearing these days. If things get more serious, you move into acute care. Maybe you put off your preventative care, or you're not taking care of your chronic care management. Acute care is a hospital stay, surgery, or worse, even an ER visit. And after that, post-acute care helps you get back on your feet, rehab, home health, skilled nursing. But it doesn't stop there. As our population ages, long-term care, assisted living, nursing facilities, and home-based support has become critical, especially for caregivers who don't necessarily live in the same states or close by. The silver tsunami is already here, and it affects how we think about families, policy, and healthcare delivery for older adults. Every step involves different organizations, regulations, and payment systems, and none of it works unless everyone's in sync, which is where the law quietly holds everything together. The legal glue. Okay, so now here's where it gets interesting for us health lawyers. Every transition in that ecosystem, it has rules and it has regulations. Are you opening a new clinic? Great, but you're also navigating state facility licensure, Medicare enrollment with CMS, and maybe your state has a required certificate of need review. Telehealth monitoring. Okay, that's HIPAA. State telehealth rules, and now AI and data privacy compliance too. And if that company partners with hospitals or physicians, you can add Stark Law, anti-kickback statute, and state mini AKS into the mix. Even long-term care operators juggle CMS conditions of participation, state surveys, and quality standards. The point of this isn't to make your head spin. It's that law actually keeps the ecosystem alive. It ensures care is safe, compliant, and connected. And COVID really drove that home. Telehealth boomed, hospitals coordinated like never before, and regulators issued 1135 waivers so care could continue safely. The best part of what we learned during COVID was that all of these areas couldn't work as siloed, which is why we're now seeing it as an ecosystem, where one thing affects the other thing, which affects the other thing. Everything's interconnected. The ecosystem had to adapt, and the law, it has to follow. Sometimes it's catching up a few steps, maybe even a mile behind. So how does this podcast fit in? Health Law with Tara Ravi is about exploring the laws and the policies and the operational decisions that make the system work, or sometimes make it more complicated than it needs to be. We view it both as a healthcare attorney, but also as a patient consumer who experiences healthcare and engages in healthcare. Each episode will cover topics like how value-based care programs actually work and why lawyers sometimes lose sleep over them, how health systems expand across states without running afoul of licensing and regulation, what the future of healthcare looks like as data and AI and law collide, and of course the challenges of long-term care as our parents and grandparents age. We'll talk about all of this in plain English, with stories, examples, and maybe a little bit of humor because healthcare law doesn't have to feel like reading the Federal Register. It's the backbone of how people get care every day. Thanks so much for listening to Health Law with Tara Ravi. I hope you'll find new ideas, helpful insights, or even a little inspiration along the way. If you like this episode, hit subscribe so you never miss a conversation, and share it with colleagues, friends, or anyone passionate about their healthcare. Everything we've talked about, episodes, insights, and conversations, is waiting for you at tararavi.com. Don't forget to check out the Resources tab on the website, where you can access laws, guidance, or materials referenced in today's episode. See you next time when we continue exploring health law with some heart.